For decades, millions of seniors have been told that sleep medications are the answer to their restless nights. But what if I told you that the most prescribed sleep aid for people over 60 is actually stealing their memories, one night at a time? I'm not here as your doctor, but as a health educator who spent years researching the hidden dangers lurking in our medicine cabinets. Today, I want to share with you a truth that could save your cognitive future. Every night, countless seniors reach for that little pill, believing they're choosing rest over insomnia. What they don't realize is that they may be choosing temporary sleep over permanent memory. The medication I'm talking about doesn't just help you fall asleep. It fundamentally changes how your brain processes and stores memories while you rest. And the most alarming part? Many people have no idea this is happening until the damage becomes impossible to ignore. The drug at the center of this controversy is one you've almost certainly heard of, possibly even taken yourself. It's been prescribed to seniors for decades, praised for its effectiveness in promoting sleep. Doctors write millions of prescriptions for it every year, often without fully explaining the long-term cognitive risks. This isn't about pointing fingers at the medical community. It's about understanding what happens when we prioritize short-term relief over long-term brain health. Sleep problems affect nearly 70% of adults over 60. As we age, our natural sleep architecture changes dramatically. We spend less time in deep sleep, wake up more frequently during the night, and often find ourselves lying awake for hours, watching the clock tick toward morning. It's frustrating, exhausting, and impacts every aspect of daily life. When traditional sleep hygiene methods fail, the appeal of a pharmaceutical solution becomes almost irresistible. This is where the problem begins. The most commonly prescribed sleep medication for seniors belongs to a class of drugs called sedative hypnotics, with the leading culprit being zolpidem, better known by its brand name, Ambien. While there are other medications in this category, zolpidem represents the largest threat to senior cognitive health due to its widespread use and particular mechanism of action. Zolpidem works by enhancing the effects of gamma-aminobutyric acid, or GABA, a neurotransmitter that naturally calms brain activity. Under normal circumstances, GABA helps regulate the transition between wakefulness and sleep. However, when zolpidem artificially amplifies this process, it doesn't just promote sleep. It fundamentally alters the brain's ability to form and consolidate memories. Here's what's happening in your brain when you take this medication. During natural sleep, your brain goes through several critical stages, each serving a specific purpose in memory formation and cognitive maintenance. The deepest stage, called slow-wave sleep, is when your brain literally cleans itself, flushing out toxic proteins that accumulate during waking hours. This is also when your brain transfers information from short-term to long-term memory storage, a process called memory consolidation. Zolpidem disrupts this entire system. While it may help you fall asleep faster and stay asleep longer, it significantly reduces the amount of time you spend in slow-wave sleep. Think of it like this. Imagine your brain is a library that needs to file all the books from the day into their proper locations. Zolpidem is like dimming the light so much that the librarians can barely see to do their work. The books get shoved into random places, or worse, some get lost entirely. The research supporting this concern is both extensive and alarming. A landmark study published in the Journal of the American Geriatric Society followed over 3,000 adults aged 65 and older for 7 years. Those who regularly used zolpidem showed a 51% increased risk of developing dementia compared to those who never used the medication. Even more concerning, the risk increased with dosage and duration of use. Another study conducted by researchers at the University of Washington examined the brain scans of seniors who had been taking zolpidem for more than a year. What they found was startling. significant reductions in brain volume, particularly in areas responsible for memory formation and recall. The hippocampus, which serves as the brain's primary memory center, showed the most dramatic shrinkage. In some participants, the changes were equivalent to 3 to 5 years of normal aging, but the damage doesn't stop at memory formation. Zolpidem also interferes with memory recall, your ability to access information you've already stored. Users often report feeling foggy or confused the day after taking the medication, a phenomenon known as the hangover effect. This isn't just grogginess from deep sleep. It's your brain struggling to access memories that were improperly filed the night before. The medication also affects what researchers call procedural memory, the type of memory that helps you remember how to perform tasks you've done countless times before. This explains why some Zolpidem users report increased clumsiness, difficulty with routine tasks, or a general sense that familiar activities feel strangely unfamiliar. Perhaps most troubling is the impact on what neuroscientists call prospective memory, your ability to remember to do things in the future. This type of memory is crucial for medication adherence, keeping appointments, and maintaining independence as we age. Studies have shown that regular Zolpidem use can significantly impair prospective memory, leading to a cascade of problems that extend far beyond sleep quality. The mechanism behind this memory destruction is complex but understandable. When Zolpidem binds to GABA receptors in your brain, it doesn't just promote sleepiness, it actively suppresses the neural activity necessary for memory consolidation. Your brain needs a certain level of organized activity during sleep to process the day's experiences and convert them into lasting memories. Zolpidem essentially puts this process on pause. Additionally, the medication affects the production of acetylcholine, a neurotransmitter that plays a crucial role in attention, learning, and memory formation. Reduced acetylcholine activity doesn't just impact memory. It affects your ability to think clearly, make decisions, and maintain focus during waking hours. The timing of when you take Zolpidem also matters significantly. Many users take the medication and then engage in activities like reading, watching television, or having conversations before bed. Because Zolpidem can take effect within 15 to 30 minutes, memories formed during this window are particularly vulnerable to disruption. Some users report having entire conversations or completing tasks with no memory of them the following day. This phenomenon, called anterograde amnesia, can be especially dangerous for seniors. Imagine taking your evening medications, having an important phone call, or receiving critical information about a family member's health, only to wake up the next morning with no recollection of any of it. The implications for safety, relationships, and overall quality of life are profound. The risk factors for Zolpidem-induced memory problems aren't evenly distributed among users. Age is the most significant factor. Adults over 65 metabolize the drug much more slowly than younger individuals, leading to higher concentrations remaining in the system for longer periods. This explains why many seniors experience hangover effects well into the following day, even when taking the medication as prescribed. Gender also plays a role, with women showing greater sensitivity to Zolpidem's memory-impairing effects. This is partly due to differences in metabolism and body composition, but hormonal factors may also contribute. Postmenopausal women appear to be at particularly high risk for cognitive side effects. Other medications can amplify Zolpidem's impact on memory. Many seniors take multiple medications, and certain combinations can be particularly problematic. Antihistamines, muscle relaxants, and some blood pressure medications can all enhance Zolpidem's sedative effects, while simultaneously impairing cognitive function. Alcohol consumption, even in small amounts, dramatically increases the risk of memory problems when combined with Zolpidem. Even a single glass of wine with dinner can significantly amplify the medication's cognitive effects, leading to severe memory impairment and increased fall risk. The duration of zolpidem use is another critical factor. While short-term use, defined as less than 2 weeks, carries some cognitive risk, the real danger emerges with long-term use. Many seniors find themselves taking zolpidem nightly for months or even years, often because their underlying sleep problems were never properly addressed, or because they've developed tolerance and dependence. Tolerance to zolpidem's sleep-promoting effects can develop surprisingly quickly, sometimes within just a few weeks of regular use. As tolerance builds, some users increase their dosage without medical supervision, dramatically escalating the risk of memory problems. Others find themselves taking the medication earlier in the evening or combining it with other sleep aids, both of which can worsen cognitive effects. Perhaps most concerning is the issue of dependence. While zolpidem was originally marketed as having low addiction potential, clinical experience has shown that psychological and physical dependence can develop, particularly in seniors. When users try to stop taking the medication, they often experience rebound insomnia that's worse than their original sleep problems, leading them to resume use despite concerns about memory effects. The memory problems associated with zolpidem use often develop gradually, making them difficult to recognize initially. Users and their families may attribute increasing forgetfulness to normal aging rather than medication side effects. This delayed recognition means that many people continue taking the medication long after it's begun affecting their cognitive function. Family members are often the first to notice changes. They may observe that their loved one seems more confused, has trouble following conversations, or repeatedly asks the same questions. These subtle changes can progress to more obvious memory problems, including difficulty remembering recent events, trouble learning new information, and increased confusion about time and place. Healthcare providers sometimes miss the connection between zolpidem use and memory problems, particularly when patients don't volunteer information about their sleep medication use. Many seniors see multiple doctors and may not think to mention their sleep aid when discussing memory, concerns with a neurologist or primary care physician. The good news is that many of the memory effects associated with zolpidem use are reversible, particularly if caught relatively early. Studies have shown that cognitive function often improves within weeks to months after discontinuing the medication, though complete recovery may take longer in some individuals. However, stopping zolpidem abruptly can be dangerous and should never be attempted without medical supervision. Withdrawal from sedative hypnotics can cause seizures, severe anxiety, and dangerous rebound insomnia. A gradual tapering schedule, often involving dose reduction over several weeks or months, is typically necessary for safe discontinuation. The process of stopping zolpidem requires a comprehensive approach that addresses both the physical dependence and the underlying sleep problems that led to medication use in the first place. This often involves working with healthcare providers to identify and treat root causes of insomnia, which may include medical conditions, other medications, or lifestyle factors. Sleep hygiene modifications form the foundation of non-pharmacological sleep improvement. This includes maintaining consistent sleep and wake times, creating an optimal sleep environment, limiting daytime naps, and avoiding stimulants like caffeine late in the day. While these recommendations may seem basic, their consistent implementation can dramatically improve sleep quality without cognitive risks. Cognitive behavioral therapy for insomnia, known as CBTI, has shown remarkable effectiveness in treating sleep problems in seniors. This approach addresses the thoughts and behaviors that contribute to poor sleep, teaching specific techniques for managing racing thoughts, reducing sleep anxiety, and optimizing sleep efficiency. Research consistently shows that CBTI is as effective as medication for treating insomnia, with benefits that persist long after treatment ends. Natural sleep aids offer another avenue for improvement, though they should be used judiciously and under professional guidance. Melatonin, when used appropriately and in proper doses, can help regulate circadian rhythms without the memory-impairing effects of prescription sleep medications. However, timing and dosage are crucial. Most people use too much melatonin and take it too late in the evening. Magnesium supplementation has shown promise for improving sleep quality in seniors, particularly those with deficiency. This mineral plays a crucial role in muscle relaxation and nervous system function, and adequate levels can support natural sleep processes without cognitive interference. Herbal remedies like valerian root, passion flower, and chamomile have been used for centuries to promote relaxation and sleep. While the research on these substances is less robust than for pharmaceutical options, they generally carry lower risks of memory impairment when used appropriately. Lifestyle modifications can have profound effects on sleep quality and overall cognitive health. Regular physical activity, particularly when performed earlier in the day, can improve both sleep depth and memory function. Exercise promotes the release of brain-derived neurotrophic factor, a protein that supports the growth and maintenance of brain cells, particularly those involved in memory formation. Diet also plays a crucial role in both sleep and cognitive health. Foods rich in tryptophan, such as turkey, eggs, and cheese, can support natural serotonin and melatonin production. Avoiding large meals, alcohol, and caffeine close to bedtime can prevent sleep disruption and reduce the temptation to rely on medication. Stress management techniques like meditation, deep breathing exercises, and progressive muscle relaxation can address the anxiety and racing thoughts that often contribute to insomnia in seniors. These practices not only improve sleep quality, but also support cognitive function and memory formation. The bedroom environment deserves special attention in any comprehensive approach to sleep improvement. Temperature control is crucial. Most people sleep best in rooms kept between 65 and 68 degrees Fahrenheit. Light exposure should be minimized, with blackout curtains or eye masks blocking external illumination. Electronic devices emit blue light that can interfere with natural melatonin production and should be avoided for at least an hour before bedtime. Noise control is equally important, particularly for light sleepers. White noise machines, earplugs, or fans can mask disruptive sounds that might otherwise fragment sleep. Creating consistent pre-sleep routines signals the brain that it's time to wind down, making the transition to sleep more natural and less dependent on pharmaceutical intervention. For those currently taking zolpidem or similar medications, the decision to discontinue should never be made unilaterally. Healthcare providers can assess individual risk factors, evaluate alternative treatment options, and design safe tapering schedules when appropriate. They can also investigate underlying medical conditions that might be contributing to sleep problems, such as sleep apnea, restless leg syndrome, or hormonal imbalances. Regular cognitive assessment can help track improvements in memory function after medication discontinuation. Simple tests of memory, recall, attention, and executive function can provide objective measures of cognitive recovery and help motivate continued adherence to non-pharmacological sleep strategies. The relationship between sleep and memory is bidirectional. Poor memory can contribute to sleep anxiety, while sleep problems can worsen cognitive function. Breaking this cycle requires patience, persistence, and often professional support. Many seniors find that combining multiple approaches, behavioral changes, environmental modifications, and carefully selected natural supplements provides the best results. It's important to recognize that improving sleep quality and protecting memory function is a marathon, not a sprint. The changes associated with safer sleep practices often take weeks or months to fully manifest, while the memory-impairing effects of zolpidem can be noticeable within days of starting the medication. This mismatch in timing can make pharmaceutical solutions seem more appealing, but the long-term cognitive costs are simply too high to ignore. The science is clear. The medication that millions of seniors trust to provide restful nights is systematically dismantling the very cognitive abilities that define who we are. Memory forms the foundation of our identity, our relationships, and our independence. No amount of improved sleep is worth sacrificing these fundamental aspects of human experience. Your brain possesses remarkable resilience and capacity for recovery, even in later decades of life. By removing the pharmaceutical obstacles to healthy memory function and embracing evidence-based alternatives, you can protect your cognitive future while still achieving the restorative sleep your body needs. The choice between temporary relief and long-term cognitive health isn't really a choice at all. It's an opportunity to reclaim both your nights and your memories. Remember, it's never too late to prioritize your cognitive health and explore safer paths to better sleep. Your future self will thank you for the courage to question conventional wisdom and choose the preservation of your most precious asset, your mind. 7 blood tests. Your doctor orders, but you don't need after 65. Dr. Evelyn Hart explains.